Good afternoon, everyone. Welcome to the City of Alameda's Mayor's Town Hall. I'm Sarah Henry, the city's Public Information Officer. Joining us today is Sean Parkin, CEO of City Health Urgent Care, the operator of the new COVID-19 testing unit coming to Alameda next week. Please note, all participants have been muted. To submit a question for the mayor or for Mr. Parkin, please use the chat feature. All of our town halls are recorded and are available on the city's website and the YouTube channel. I'd now like to turn today's town hall over to Mayor Marilyn Ezzy Ashcraft.
Thanks so much, Sarah, and welcome everyone. It is great to see you. And this has been such an opportunity. I was just telling our fabulous guest, Sean Parkin, before we started, that this is an opportunity for me on a weekly basis to present some fabulous guests that are so informative for our community and to allow you to be informed and also to ask your questions in real time. You can ask me too, but I'm not nearly as interesting as he is. But anyway, this is, as you know, testing is such an important topic. You've heard me say real soon now for a long time, and now we have a hard start date. And so I just want to thank you. I know I can just see some of the names coming in that we have members of our business communities and business associations. You've all been impacted by COVID, as we all have. I'm really proud of Alamedans, our residents and businesses, for the efforts that they are making to take COVID-19 seriously and protect themselves and others. A huge shout out to Kyle Connor over at Alameda Theater. I hope you've seen his marquee now that he's put up a message about how important it is to wear masks. And I think I saw Twin Towers Methodist Church put a message out too on their sign. And just getting the messaging out helps so much. And then I just want to send a shout out to our governor, Gavin Newsom, and apologies, Governor, I know I'm talking over you because he's doing his news conference right now, but at least we aren't in the state of, say, Georgia, where the governor is suing mayors and city councils for trying to enforce mask wearing in some of the areas that have been hardest hit and are having the highest hospitalization rates. So we are fortunate to be here in California and to have our elected leaders really all on the same page about this. But anyway, you're here because you want to hear from Sean Parkin, who is the CEO of City Health Urgent Care, that he'll tell you more about, and I'll let him give you all the details, but suffice it to say that next week in the city of Alameda, there will be a testing facility. And so without any further ado, I welcome and thank Sean Parkin for taking time out of his busy day to talk to all of you. Welcome, Sean.
Thank you, and thank you, Mayor Ezzy Ashcraft, for having me on your weekly check-in with the community, and also thank you for your partnership as we put this project together. We certainly could not do this without the cooperation and collaboration of you and your whole team. Also, a quick shout out to CBRE Property Management. They've generously donated their space on Wind River Way in the office park.
Nice.
And again, couldn't do without them. And a huge shout out to my whole team at City Health. Without the team, we couldn't make this happen. So, and as a community, this is really a collective effort to get our hands around COVID-19. It's not anything that can be done singularly in a vacuum. We have to work together to try to fight this. So as a small organization, I am really excited to do what we can to do our part to try to fight it. Testing is vitally important. If we don't know where the positives are, we won't know how to try to tamp it down. So very glad that we can do that. We are going live next week on the 22nd at 200 or 300 Wind River Way.
That's Wednesday, July 22nd, right?
Yep, 9 a.m. We're going live. Right. So we actually put up a landing page for it off of our website, which is cityhealthuc.com. And there
Sarah's
is
I just know Sarah's going to put that up in the chat, right? Yeah, I'm sorry, keep going.
So there is a scheduling tool there on our homepage, so you can actually schedule a visit in advance, which we highly encourage. And we've already, I think within hours, we had about 150 people already sign up, which
Great.
is it's great. I mean, there's certainly a surging demand for this. So with the ability to schedule in advance, with some of the technology that we're using on site to help facilitate our walk-in patients, we can probably get about 1,000 people per day
Per day. Whoa.
safely through the space, and that's the number we're actually anticipating. As you're all probably aware, it's tough to get tested. There's a lot of confusion about where to go, how it works. Sarah and I were talking earlier about some of the testing options that are out there, and it might be efficient to get them done, but then you have to wait, sometimes up to a week to get the results. Sometimes the results never actually come back. So it's confusing. What do you do during that intervening time? If it comes back positive, then you try to contact trace that amount of time backwards about who you might have been in contact with. So getting those results and getting them quickly is really the key. We're fortunate to have partnered with a company called Quidel, and they've provided us with some of their point of care analyzer machines. It's sort of the latest, greatest analyzer that we use for our in-house lab testing to give you results, and it comes back quickly. So we get results within 15 minutes of running the sample.
Whoa.
Which is great. So you will
while you wait?
Yeah. Mm-hmm. Yep. So the idea is to funnel people efficiently through our registration process, whether that's online in advance of getting to our site, or actually when you arrive. We will register you and get you in the system. Then you get swabbed, and then the sample goes right to our lab, which we have stationed there. And the results come out in 15 minutes. So you will leave with the results in hand. And we have physicians assistants on site to consult with you about your results and talk to you about what your symptoms may be. And in some cases, to actually evaluate somebody medically to see if they need to go somewhere else for care.
And tell us about the advice, and I am going to just jump in and ask some questions as you go. Sean, tell us about what you would tell someone both who tested negative and someone who tested positive.
So the people who test negative, that's great, but just remember it's a snapshot in time. So it tells me where you are in the moment, right? So at the moment, you're not actively shedding virus. And the analyzers that we used are certified by the FDA under the emergency use authorization to be 97.9% accurate. So it's as good essentially as the nasal PCR test, which happens in the larger CLIA labs.
So actually I should back up just a little. So
Mm-hmm.
Is this not a nasopharyngeal test?
Oh, it is. Unfortunately, you're not spared the discomfort, unfortunately, of having the nasal swab, which isn't horrible, but I understand it doesn't feel great. I do it myself every week, and I don't dread it, but it is a little uncomfortable. I will admit. So the virus really likes to hang out there in the posterior nasopharynx, which is where that swab gets to. And that's where it really aggregates, and so by getting the sample there, it increases the opportunity of getting a very accurate result.
Okay, got it.
But you can test negative on a Tuesday and positive on a Wednesday. So it's extremely valuable data, but it's not a one-off where you get it done and you can go through the rest of the pandemic, thinking that you don't have it or you're not going to get it.
And you shouldn't stop wearing a mask, right?
Thank you. No, you should not. And when I started talking about as a community, we are going to put our hands around this and tamp it down. Yes, wearing a mask is the way to go. I was going to talk a bit about the mode of transmission, but let me first answer your question about the what to do when you're positive. You know, when you're
Thank
negative,
you.
awesome, that's great. Do it on, do these in regular intervals and continue to act as if everybody around you is positive, and that you yourself might actually be spreading it later that day or the following day. But for those who are positive, it's a scary thing to happen. When you get that positive result, it looks like 60% of people who are testing positive are asymptomatic carriers. And then then there are people who are pre-symptomatic, and then there are people who are symptomatic, and then the varying degrees of symptoms for that cohort. The small minority of people will die from it, and then a small group of people will also end up getting hospitalized and on respiratory support. But the vast majority of us who get it will be either mildly symptomatic or completely asymptomatic, which can really sort of play with your psyche, knowing that you could fall into that group.
And what about contact tracing? How does that work into the positive diagnosis?
Yeah, so I'm actually trying to find a solution for contact tracing that we can integrate with our results. We actually use software called Varina, which will aggregate all of our data so that we can view our data, and that integrates with the CDC's database. There's actually a Verizon wireless chip in our machines, which are constantly being interrogated by the CDC. So we're sharing encrypted data with the CDC in real time, which is super valuable. But we can also view the data ourselves, and it would be wonderful if we could take that one step further to contact tracing. I am looking for a solution for contact tracing software, but in practical terms, it's a question of who were you in contact with, when was that contact, and what was the degree of the contact.
And Sean, do you report the results to the county?
We do. So we have for each positive, we submit a form to the Alameda County Department of Public Health.
Okay, so I do know from the conference calls I've been on with them that they are working to increase the number of contact tracers working for the county. So any positive,
Right.
as I understand it, but you can please supplement, as I understand, any positive case reported to the county will be connected with someone for contact tracing.
They should be. I can't verify that that's the case, but that is in theory how it's supposed to work.
And that's certainly what I'm hearing from the calls. And one of the things that they tell us on those calls is to tell your residents to please, when you get a call from County Public Health, answer it, and then don't be afraid to answer, because that's what they have to do to start the whole process of contact tracing. But do you advise someone who's been tested positive about isolating and those kinds of things?
We do. So in addition to filling out the DPH form, we also give them a handout in their native language, which will tell them how to self-isolate and the risk that they pose to people around them.
And are any of your staff bilingual in any languages?
Yeah, we have a lot of bilingual staff. We have bilingual Spanish, bilingual Mandarin, bilingual Cantonese. So we're fortunate. We have a terrific staff that are quite versatile.
Excellent. All right. So keep going. I'll stop peppering you with questions for the moment.
Oh no, the questions are great. I love them. Thank you. So as far as the mode of transmission goes, it's pretty clear that this is an airborne disease. It's extremely, extremely contagious. The little tiny nanoparticles just love to float in the air and wait for a new host to inhale them. And this is why, being in an enclosed space is such a huge risk. As we exhale, we emit the virus particles, and as we speak, we emit more. The louder we speak, the more you have to put air across your vocal cords, the more potentially viral particles you're emitting to the air around you. A mask is really a terrific defense for these exhaled particles. The larger droplets will get captured by even a simple cloth mask. A N95 respirator that filters the microparticles, unfortunately, is the only tool as healthcare workers that we have to protect us. So we do wear those as we evaluate our patients, and we do operate in an open air environment to reduce the risk of these little particles floating around and hanging out.
Oh, explain what you mean by that, the open air environment.
Yeah, simply put, we're outdoors. So we're outdoors under canopies, and on Wind River Way, as the name would suggest, it's breezy. So that helps. It helps kind of whisk away these viral particles that people might be exhaling. We do have a mask policy where anybody who's in our space has to wear a mask, no exceptions. If they do not have a mask, we'll provide one for them. I think most people do, but we also enforce, compliance in how you wear the mask. So, wearing it on your chin doesn't really count.
Thank you. And so you're supposed to cover your nose and mouth, are you?
You are actually, thank
Yeah,
you.
yeah.
It's frustrating.
Frustrating.
Yeah, wearing it under the nose doesn't really do. I mean, it does, I guess, in a small amount, reduce it. But no, it doesn't. It's you're exhaling through the nose, and yeah, got to
And
cover the whole.
you're also inhaling through the nose, so
And inhaling.
that road could work both ways. And let's see, I
That's
think you
right.
mentioned that the test site will open at 9 a.m. What
Mm-hmm.
time will you close?
5 p.m.
5, so 9 a.m. to 5 p.m. Wow, and you
Mm-hmm.
can do 1,000.
Yeah,
That's
we can
amazing.
do it.
How
Yeah.
long does a test take?
It's very quick. So the swab itself, if you've ever had it, is pretty quick. It's like 10 seconds of somebody putting the Q-tip in your nose.
Okay, so 10
And
seconds of discomfort. We can all do that, right, everybody? I've heard it's not that bad. I haven't done it, but
it's not
okay,
bad.
so about 10 seconds, and then
Mm-hmm. And then it's 15 minutes in the machine.
okay.
So the only rate limiting factors would be time to registration and time to getting the machine pushed through the analyzer. So we have it set up so that people will walk, through the registration. If they've pre-registered, which please do, if you want to get tested, go sign up on our website through the scheduling tool and check in online in advance. Once you're checked in, just so much simpler. And then you get the sample, and then you go to a waiting area. So there's sort of a grassy area that CBRE has been nice enough to allocate for sort of a waiting area, a socially distanced waiting area where people go while they're waiting for the results.
So is that under some sort of a tent, and there's chairs or something?
There is some tree coverage there for shade, but
Okay.
yes, we'll also offer some canopies to protect from the sun. And the wait time should be minimal. It should be 15 to 30 minutes. And then one of my colleagues will come out and inform them what the results are.
Okay. So this sounds like if you drive there, you're going to park your car, but there's a lot of parking in the Wind River parking lot, and then walk over. What about someone who has some physical mobility limitations?
Yeah, glad you asked. We do have priority parking for people who might have mobility issues. There's lots of handicap spots, um, and and we definitely accommodate anybody who comes in without an appointment. We actually have a line monitor who's assigned to keep an eye on people in the line, and they will pick out anybody from the line who looks like they're having trouble being in line.
Right.
You know, whether they look like they're ill, or if they're a senior, or if they have mobility issues that make it uncomfortable for them to be in the line, they get moved to the front.
Okay, that sounds good. What else should our listeners know?
Um,
Actually, can I jump in? I realized when I
yeah.
introduced you, I didn't ask you to tell your background. You've obviously got some medical background. You want to tell us about yourself, please?
Sure. I'll be brief. So I started my career as a paramedic, and then transitioned to being an emergency medicine provider after going to PA school. And I
PA
sort of
being
a
physician assistant?
physician
Yeah,
assistant. It's kind of odd that it's a bit of an unknown career path, although I think it's getting more notoriety these days.
it's a great career.
Um, but for folks who don't know what it is, it's similar to what a nurse practitioner is. And although there's sort of less nurse practitioners working in my space, they do have more acceptance of sort of what that role is. So we collaborate closely with our physician colleagues, and we're licensed medical practitioners.
Great.
So I realized very soon on that the medical system wasn't working the way I wanted it to, and I really got very interested in learning how to make it work better in the private sector, and so started opening urgent cares of different iterations.
How long have you had the one in San Leandro?
4 years, coming up on 5.
Wow.
Yeah,
And are you doing testing at the San Leandro site as well, or in San Leandro?
we are. We're currently we started testing there, and it started a little bit slow initially, and then we quickly gained steam, and quite frankly, just outgrew our space, and so having the opportunity to work with Alameda on a larger venue is really wonderful. Yeah.
It's wonderful for us too. And then, but that's a good question. Does someone have to be an Alameda resident to be tested?
No, not at all. We take all comers, and that's probably a good chance to also talk about insurance and the confusion about insurance and eligibility and everything
Cost
else.
and all
So
that. Please take
I'm
it
just going
away.
to keep it really simple. If you want to get tested, come in and we'll test you. Any U.S. government issued ID gives you the entitlement to get tested, and we have through the Department of Health and Human Services, we partner with them to facilitate the testing. So if you have health insurance, whether it's Medicare or a commercial carrier or a county plan, we'll charge your insurance, and the insurance companies have pledged to waive co-pays and co-insurance, so they'll cover it in total. In fact, the CEO from Blue Shield was just on Talk of the Nation on NPR this morning discussing it and reiterating his pledge to, from his organization, that they're going to follow the national and state guidelines for insurance, which is that they pay for you to get tested. They want you to get tested.
Great.
So
What
then
if
that brings me
someone,
up.
sorry, go, yeah, you go ahead. You've got it.
You're probably going to ask, what if they don't have symptoms, right?
Oh, no, I was
So
going to say, what if someone doesn't have insurance?
if they don't have insurance, it's covered by HHS.
Okay.
Yeah.
Health
So
and Human Services. So,
that's right. Yeah.
so no,
And
no cost.
no cost. There's no cost. Please come in. Don't be afraid if you don't have insurance to come in and get tested. We're going to test you.
And then a little earlier this week, our State Secretary of Health and Human Services, I think it's Dr. Mark Galley, came out with some updated testing guidelines about criteria. Can you talk a little bit about that?
Yeah, I'm curious about whether that was for the county-funded testing sites, because it wouldn't apply to us. You know, as a private practice, we decide who's going to get tested, and you know, the more people who get tested, the more significant data we collect, and the more we can pick off those asymptomatic or pre-symptomatic carriers. So we're doing the right thing by getting everybody tested. And until somebody comes along and says you can't do it, we're going to continue to do it. And we're, as far as I'm concerned, entitled to.
Well, I mean, the tier one priority, I'm just looking at the guideline that was issued, actually from our state public health officer, Dr. Sonia and Angel, is the top tier one priority is hospitalized individuals with COVID-19 symptoms. So obviously hospitalized individuals would not be coming to you, they'd be in the hospital. And then I think they're just wanting to make sure that higher risk individuals like our essential workers, who include food servers. You know, we've now opened our restaurants to outdoor dining, and our grocery store workers, not to mention healthcare workers. We want to make sure that they're being tested. But it does seem that at 1,000 tests, a capacity of 1,000 tests a day, that would cover quite a few. And then I guess I also wanted to ask, how long do you think you will be set up in Alameda to do the testing?
We'll be there as long as everybody wants us to be there, and as long as there's a need for us to be there. We're not, you know, I don't plan on going anywhere. As long as, you know, as long as the crisis is here and our need is present, we'll keep doing it. And to, I guess, to further answer your question, the federal government has shifted allocation of a lot of the testing towards hospitals, and towards some of the hotspot facilities, such as long-term care and skilled nursing facilities. So there's definitely a movement to do that. And we do at City Health, we do contract with public safety entities such as the City of Oakland, the Oakland Police Department, Oakland Fire Departments, and some of the other EMS and frontline essential workers, both in the public and private sector. So we definitely know that that's a priority. And actually, when you come on site, you'll notice there's going to be an area that's marked for our corporate clients to park, and you'll see a lot of that's going to be fire and police apparatus that are parked there.
Okay.
Because we want to make sure that that they're safe when they're out there in the streets.
Absolutely, and in contact with a lot of people. Does your clinic or your operation have any capacity to do mobile testing, for instance, say to go out to a assisted living facility and test residents and staff there?
We're doing it.
We're doing it. All right. Are we doing it?
So
are we doing it in Alameda?
We're doing it in Alameda. The only rate limiting step right now is the availability of more of the analyzers. So we may, we're supposed to get more coming online shortly, which will open up the possibility for more mobile units to go out and service the community in that regard. But you know, even if we have to partner with a lab and get a shorter turnaround time, we'll do that.
Wonderful. That makes me feel better. Can you talk about a little, and then I'm going to switch over to Sarah to see if we have questions coming in, but can you talk to us, Sean, about the data trends you're seeing? Because obviously you're in a position to have seen lots of results coming in.
Absolutely. So unfortunately today we hit a number that we didn't want to hit in the United States. I think it was a 78,000 increase in a day. And that was published on the front page of the New York Times. We're seeing a huge upward trend in our positives, and even here in California, I think looking at the Johns Hopkins coronavirus website, which is an amazing resource for data collection. It's quite current. Los Angeles is top of the pack now. 147,678 confirmed in LA County.
Wow.
And I checked the Alameda County Department of Public Health website yesterday, and I think there were only 183 in Alameda, which is a good number. But with the under testing means going to be under reporting. So we definitely, by offering more of that data, we'll be able to publish it, and we'll keep you, we'll definitely keep you in the loop with our internal data, so you can get it in real time. In looking at what we're testing at in the last couple weeks, with a cohort of 4,000, we're looking at a 7% positive rate.
I was just going to ask you about positivity rate. Yeah.
That's right. Yep. So 7% positive out of our San Leandro and our Oakland office. We also, we do have an office, an urgent care center in Oakland City Center. And we're doing somewhat limited testing there just because the physical space doesn't support widespread testing.
Mm-hmm.
But between the two, and we're also trying to preserve, we do offer urgent care services, and we're making that as COVID safe as we can. And so we're trying to preserve that experience. And so with the two centers, we're running 7%.
So tell us a little bit more about what that means, because standing on its own, 7% is just a number. Is there a positivity rate that, when does it become problematic?
Now,
yeah,
it's already
now,
problematic.
7%. Yeah, I guess I was thinking that is it nationwide? We're trying to stay under 10% positivity. We're probably beyond that now.
Yeah, I think we're probably going to tip over that. And, certainly in states like Florida and Georgia.
And Georgia, where the governor will sue the mayor if they try to enforce masks. Sorry, I said that already. But yeah.
Mm-hmm.
And so what that's saying is that of all the cases tested in Alameda in these areas, 7% are coming back positive.
Mm-hmm.
So, okay, so we need to get that number down.
We do. And that number is going up. And, I think it's probably, falling on different demographics. It's hitting different demographics harder than others. The Latinx community is getting hit extremely hard right now. And, we're, hopefully the word can get disseminated with, within different demographic groups, how to prevent the spread.
Right. I see Sarah looking like maybe we've got questions from our audience coming in.
Yeah, I have a good amount of questions
let's take time for questions. Yes.
The first
thank
thing
you
that
so
came
much
in
for all this great information.
So good. The first one that came in is more of a statement, basically suggesting that the city and school board should work together to make mandatory testing before they return to in-person schooling for both students and staff. And they were thinking if that could happen, perhaps it could be a recurring process, like every 6 to 8 weeks or something like that, until the danger goes away. That was a recommendation from somebody. Another person asked.
Thank you. Good suggestion. Sean and I are both listening. and I hope maybe a school board member or two is on here. But
another person asked about antibody testing, Sean.
Antibody testing, so there's IgG and IgM antibodies, which you can measure for reactivity, and you'll build IgM quicker, and then IgG will sort of, that's the memory antibody. So you can look retrospectively to see if you might have had an infection in the past. And there may be some utility to knowing that. For now, in terms of stopping the spread, it doesn't have a whole lot of utility because you're not actively shedding the virus unless you do both and you test positive for both, then sure, you're going to shed the virus. But, the science doesn't suggest yet that it gives you protection. There are certain viral entities that you can get over and over. And we don't know if this is one of them or if it actually gives you immunity. So if it does give immunity, then it opens up the door for, convalescent plasma donations and, development of more advanced treatments. But I don't have any answer on that yet. based on what I've read. There's probably, scientists in the audience that have a more sophisticated answer than I do. But it is looking through the retrospectoscope, but it's not actually giving you where you are in the moment.
Got it.
And the accuracy rates are not as high as the testing you're doing. Is that correct?
I'm not sure. I actually think they're pretty accurate. I think if it goes, it's a serum sample, so you have to get your blood drawn. And my understanding is that it actually is pretty accurate. It will tell you with fair accuracy that you've had it.
Okay.
Two questions. The first is, will you be testing children? And assuming the answer is yes, could a parent mark that a child has special needs on the registration, for example, if the child had autism?
Oh my gosh, that is such a great question. Yes, we do, and yes, we are, and yes, we're very sensitive to testing kids. It's terrifying, and we do have a lot of kids with autism in our medical practice pre-COVID, and we're very sensitive to working with parents on how to evaluate them comfortably. And we know how difficult it can be for parents to bring kids into a medical practice, or God forbid an ER, and have all that stimulation and the sort of the rush of let's see this kid and get him out. So we are aware of those types of needs, and we do everything we can to accommodate them. My staff is very kind. They're very gentle. And quite frankly, they're having a lot of fun in doing this. It's a very good spirited environment. And I think kids pick up on that as well. So we do everything we can to accommodate them.
And Sean, on the registration form that you would do online, is there a space for notes or something so a parent could provide that information? Okay.
Yeah, for sure. When you book your appointment, there's a comment section that you can fill out.
Great. Sarah.
So somebody's asked if they've had close contact with somebody who's positive within 14 days, but then test negative, are they in the clear, or do they still wait out 14 more days to test or assess for symptoms?
So the incubation period is 2 to 14 days. The average being 5 days. So if they test on the 15th day, if they test negative, I would say they're in the clear for that encounter. What happens, during the other 14 days, who can say? But for that particular exposure, the CDC data is 14 days.
Great. The next question is asking about the results, which you get in 15 minutes, which is amazing. And they're asking, is that all of the results that you're going to get, or is there a second result that comes sometime later?
The second result that will come sometime later is if they come back. Coming back to get rechecked is recommended. And that, it does just give you that snapshot in time of where you are the day that you get tested.
And Sean, is that to come back if you tested positive, or?
Oh, for people who are positive. Oh, yeah. So for people who are positive, we would have them come back in a week, and then a week thereafter until they get tested. We've actually had some folks who test positive for 2 months.
Wow.
Yeah.
Oh my goodness.
Yeah.
So speaking of coming back, people are asking, how often should a person be tested?
Oh gosh, I test myself weekly because I'm exposed to people who are positive safely, I will add. But I also work closely with people. So me and my staff, we test every week. We also, of course, have the luxury of being able to do it after hours. I think it depends on what you do and what your risks are. If you have frequent exposures, then weekly testing is great. If you don't, probably once or twice a month, and then just be super cognizant of your behaviors.
Absolutely. There, a few people wrote in with questions about Kaiser, asking if you would be able to partner with Kaiser. Can they use their Kaiser plan for testing? I know you don't necessarily need insurance, but if somebody has Kaiser, how does that work?
We do take Kaiser, although we're not credentialed with Kaiser for our urgent care encounters. We do accept Kaiser for the COVID testing under emergency authorization.
Great.
Yep.
And then a couple people have asked if somebody can come in if they're asymptomatic, can they be tested, or are there any restrictions?
They can be tested.
Excellent.
Yeah.
And then, oh, go ahead, Mayor.
Well, I was going to say one of the things that I'm hearing from the county is that sometimes we start running short of some of the components or the supplies that are needed to do testing. So how are you doing on PPEs and I guess the analyzer? That's so interesting. So the analyzer, what does it require? Are there reagents or tell us a little more about that and how the supply chain is working and if it's working well.
There's definitely supply chain issues that we have to work through. I actually have appointed somebody in my organization to be the quartermaster, as I call her. And her job is to source PPE and to make sure that the supply stream is steadily flowing from for our analyzers. It is a big concern that that our supplies are going to dry up, and when the supplies dry up, so does our ability to test. So we, the Alameda County Department of Public Health has been great. They've been helping us source supplies.
Great.
And our medical vendor relationships, they've also been wonderful, and they appreciate that we're working in the in public safety, and so they've been really good at allocating us our PPE and respirators. But yeah, no, it's a big concern. I worry about it all the time.
Yeah, and I don't want to veer off into too much of a political discussion, but this crisis has certainly shone a spotlight on the shortcomings in our that our public health system is just underfunded and under supported. Universal health care, we got to get everyone insurance, and that's a whole nother topic. We'll do another town hall on that, people. But this, when you talk about it, it's a very ambitious goal, and I'm really pleased to hear you say 1,000 tests a day, and then you're also doing the nursing homes and all that. But it does rely on having all those supplies. So.
It does. And, the infrastructure is not really set up to handle it. It never has. Working in medicine for a really long time, and most of that's spent in the ER. I can tell you that hospitals always operate on the brink of failure. So, I'm looking at the county websites. I think we have 311 ICU beds in the county available.
Mm-hmm.
Available, right? So, so when people become ventilator dependent, what happens? It's scary. Our medical system it was poorly equipped going into the pandemic, and now trying to respond to it, it's just not set up for it. So, yeah, I would love to go down that political rabbit hole discussion with you.
We'll talk more on that.
I'm sure the comments are going to light up.
But I know we're not political in Alameda. It's a very non-controversial city. But it does highlight the need to wear your masks and to slow the spread of this disease, because that's what I keep saying. We just don't want, and it's not just me. I'm hang on every word from our public health officers, but we need to slow the spread so we're not overwhelming our hospital beds and our ICU beds and our medical personnel. I mean, they are exhausted. And so, all we're asking people to do is take a little personal responsibility. Come on, you can put a mask on and just do huge things. And if anybody has any ideas for reaching out to those teenagers who are a little resistant in the early 20s, send your suggestions my way. Sarah, I know you've got more questions.
Yep. Somebody asked a specific question, Sean. So they're a Kaiser member, but they've lost their wallet with their Kaiser card. They have their ID.
Mm-hmm.
Is that okay? Can they come with just their ID?
Yeah, I think so. So there is, for folks who don't have insurance, there is an attestation form that they'll fill out just to attest that they don't have insurance, so we can channel it to HHS. I do believe we need the Kaiser number to run it. We need your healthcare number to run it through.
So just a printout.
Yeah, printout's fine. If you physically don't have the card, but you have a printout of it, I think that's okay.
Great.
But
They just put in the comments that they have her, so they
Okay, I was saying, and I think Kaiser should be able to help you on that one.
Sean, what about undocumented residents?
Boy, that's tough. So if they are undocumented, we have to, we basically need to charge them a small amount, is my understanding. So we can probably have a discussion internally, or we are having discussions internally about how to handle that, because it is running pretty rampant among undocumented folks, and we don't want them to be afraid to come in, and we want to make sure we get them tested. The question is, how do we afford to do it? So we're speaking internally about how to make that happen.
And so I think I would just throw in that if I were an undocumented individual, I would probably worry about the cost because I might be making very low wages, but I would also worry that if I came in for testing, my status would somehow be reported to a government agency. Should I be worried about that?
We are under very strict HIPAA guidelines for patient privacy, which encompasses everybody. For privacy protection. So without a medical release, it wouldn't be shared, with the exception of the Department of Public Health positive data.
Okay. And they're not going to share your data with ICE?
I would hope not.
No, they aren't. Sarah, yeah.
Yeah, no, here's another question about Kaiser. Do they need to get approval first from Kaiser to get tested, or they just come by?
They don't, and for any Kaiser administrators that are out there in the audience, please don't hate me. But they don't need approval. We actually, our billing team is connected with Kaiser, and they've been covering the costs, which is great. And kudos to Kaiser for doing that.
Right, because as I understand, they're certainly not in our Alameda facility. They're not offering testing at this time, and I don't know about the others.
Yeah, it sounds like the circumstances to get tested are exceptional in Kaiser right now. I don't really know it, but I don't see that they're offering sort of large scale testing.
So our audience have confirmed that.
Thank you, audience.
So
they know more than I do.
With regards to, if you don't have insurance and you come with an ID, the ID has to be an ID issued by the United States government. Is that correct?
Yep, it can't be your gym membership ID. It has to be like a driver's license.
Well, what about your California driver's license that's issued by the state of California? It doesn't have to be federal, right?
No, it can be a green card. It can be any government issued ID, whether it's state, federal, passport, as long as it's U.S. Issued. It can be anything, any of that. Yep.
And if you were paying out of pocket, how much would the cost be?
We charge $129, and like I said, we're having discussions about how to handle people who come in that don't have documents. I think it's probably going to be lowered considerably. Mm-hmm. Yep, but we have to, of course, cover the cost somehow. So.
Mm-hmm.
Somebody asked, when contacted by a phone call from an Alameda County contact tracer, how does the resident know if it's valid versus a scammer trying to fish for their private information?
I don't have the answer, but it would be great if there was somebody on the county that could help provide some of that information.
That is a very good question, and we can get you an answer. Sarah, how will we get that information out once we get it?
We can put it up on the city's Facebook, and then people can email me, and I can, if they're not on Facebook, I can email them as well.
Sounds good.
And then what I'll just say, overall blanket advice is never give personal information like your social security number, your bank account number, credit card numbers to someone who has contacted you. And that is not something a contract tracer should be asking at all. They should be finding out, who you've had contact with in a certain amount of days. But that is a very good question. And as more of these tests or continue to take place, and there's more contract tracing going on, that is very good information that we'll get for you,
Yeah.
and we'll get it up on the city's website.
Awesome. And we can also, Sarah, we have an FAQ section on our website as
great.
well. So
Perfect.
this might be a good opportunity to pull some of these questions together and post them there.
Absolutely. That's a great idea. I have them all written down. You had said, Sean, that 60% of the people that are positive are asymptomatic. Is that specific to your facilities, or is that for everybody generally?
That was a number I pulled recently from the CDC website.
Okay.
Wow.
Okay, we're getting to the end of our questions. I have two more. The first is talking about how to get to the site at Marina Village. Can it be arranged that the Alameda shuttle will stop at the test site? It's hard to get there if you don't have a car, somebody says.
The
Line 19.
Line 19 still goes by it, but we can look into the Alameda shuttle. That is not a promise, just a promise that we'll look into it. Okay.
Great. And then, Mayor, for you, somebody has asked if we've reached out to student leadership regarding masks.
Oh, good question. It is on my list of things to do. If I don't get to it today, I'm going to get to it this weekend, because I think that is probably just brilliant, because peers will listen to their peers a lot faster than they'll listen to someone who looks like their mother or grandmother or something. Although I will say, because I can't resist myself, I carry a Ziploc in my purse at all times filled with masks, the surgical or the blue white ones. We had a lovely donation of 20,000 masks from our sister city in China. So I've always got a stash in my purse. My success rate is about 50-50, I'll just be honest with you. But when I see folks on the street, I was about to be interviewed by one of the news stations on Saturday morning, and this teenage boy's walking by looking at, but without a mask. And I said, "Ooh, please tell me you've got a mask in your pocket." And he goes, "No." And I said, "Oh, well, I just happen to have some in my purse. Can I give you one?" And bless his heart, he took one and he put it on. I hope he kept it on and didn't rip it off when he walked by. But I haven't had similar success. I've been a little more successful with adults, and they've been very gracious and taken it and put it on. The young people, not so much. They give me that fish eye. But hey, I raised a couple kids. I'm immune to that stuff. But yes, great idea to ask the young people to help with messaging. And I see one of them, I think, on here. And so feel free to email me with your ideas. I don't want to embarrass her or anything, but, or any of you who are listening, email the mayor. She would love to have your ideas, because I just, it's like Sean said, it's frustrating. I just heard on NPR, I was listening to, I think it was a nurse in Georgia, and the medical community in Georgia is just being slammed while the governor is suing the mayor of Atlanta. But anyway, I said that. But she was saying the next best thing to a vaccine for COVID-19 is wearing a face mask whenever you're outside your house. And it's that simple, right?
Yeah.
Yeah.
I think it's dangerous to think that the vaccine's around the corner, because I don't think it is. And if they do develop a vaccine, I question whether it's really going to be 100% effective. So I think this is going to be with us for a little while.
Right.
Yeah.
Well, and you talk about supply chain, then it has to get manufactured, although I think some are being manufactured, but distributed, and who gets it first and where. And yeah, no, so we can do this. We can get this under control. Other questions? And then I'm just going to ask Sean for some last words of advice.
The last question that just came in is asking about how we're doing with flattening the curve, and where our goals are at. And then that's it.
In the city of Alameda, in the county,
I think
we have,
yeah,
yeah,
everywhere.
I mean, I'm a little competitive. I'll just put that out there. And so I've said all along that I wanted our COVID-19 per capita rates to be the lowest in the county. And I want our census returns. By the way, if you haven't done your census or know someone who has not, tell them to get that in. I want that to be the highest rate in the county. We aren't the lowest. There's a few cities in the county that have lower per capita COVID rates than we do. But it's still nothing to brag about because in Alameda County, we have not succeeded in lowering, flattening the curve, let alone sending it in a downward trajectory. We just haven't since the shelter in place was put in place on March 16th. And we aren't in the second wave because we're still in the first wave, and we haven't hit flu season in the fall. So I think the summer is the time that we really need to double down, and yet it's so challenging because the weather's beautiful. And again, I'm not telling you not to go outside and enjoy yourself and have a good time. Just don't do it in groups. And now that you know that outdoor dining is allowed, we had a little, closed and then open again. And huge kudos to all you Alameda restaurants who did comply when you were asked to. I have huge respect and gratitude for you. But even now that you can open again for outdoor dining, masks are still required at all times except when you're eating and drinking your meal. And you still have to the tables have to be 6 feet apart. And that virus doesn't stop at the entrance to the patio. And so and when you're walking down the street, taking your walk, you have your mask on. And we can do this. But Sean, I'm going to give you the last word because you're the
Thank
medical
you.
expert. Thank you again so much. On behalf of the city, we're thrilled that we will start testing next week, and we really appreciate all the great information you've provided. But give us some last
Well,
words.
I am so grateful for this partnership, and for the opportunity to make a difference in our corner of the world is really fabulous. And everything that you said is 100% right. The way we have to slow this is social distancing, wearing that mask, and being really pragmatic.
Washing our hands.
Yeah, absolutely. And we can, as a community, we can help tamp this down and get ourselves to a safer place. So again, thank you. And I have to say your staff has been really amazing and just
Yeah.
a pleasure to work with.
Thank you for calling that out. Yes, huge kudos, especially to our Assistant City Manager, Jerry Bowden, who bulldogged this or pitbulled it, whatever it was. I'm not casting aspersions on dogs or anything, but he just really stayed on it. Sarah's been great. I mean, and it really does take a village because we worked with Public Works and police and fire because there's, traffic issues and getting people routed in and out safely. But it's coming next week. You heard it here. You've got the website information. Everybody go on it, make your appointment, but wear your masks. And please amplify that message to everyone you come in contact with. So thank you so much, Sean. It's lovely to
Thank
meet
you, Mayor.
you face to face. And thank you, Sarah, for doing a great job. You're getting applause, Sean. That's pretty cool. If you could hear it, they'd be all. I have to, quick little story. On the last day that we got to have a conference call with our former Alameda County Public Health Officer, Dr. Erica Pond, before she left us to become the state epidemiologist. Everybody on the call unmuted at the end, and we did give her a real round of applause, which was sweet. But anyway, we can do this, Alameda. This is a smart community. We are not science deniers, and we can get this done. So thank you for helping educate us even further. Everybody take care, stay safe, wear your mask, stay 6 feet away from everyone, wash your hands frequently, and I look forward to seeing you at our next town hall. Thanks so much. Thanks, Sarah, for all your great help.
Absolutely.
Right.
Bye, everybody. Thank you.
Bye, everyone. Great to see you. Thanks for joining us.
Bye, Sean.
Bye.
Thank you.
Thank you so much.